we want to thank everybody from sharing your noon hour with us, and also to thank you for your continued support for the World Affairs Council of Atlanta. I certainly enjoy this type of conversations that we have, particularly this. I like this forum, which is not a webinar, but it's actually like a meeting, like a roundtable. We also do something similar at the Pendleton Group. So it is great to have Maria Thacker with us. Maria is the CEO of the Center for Global Health Innovation. And to have her here with us to talk about innovation in global public health, and how the organization convene ideas to be a catalyst in public health. Maria, great to see you, and like we were talking before, this is a great opportunity to have a conversation with particular for some of us people that are not in the ecosystem of health, but you could use this as a multiplier, if you will, to tell the story of what you've done with the center and the history of that and how we got to where we are right now. And then, since we're going to be recording this, we will be able to put this in the YouTube channel, which is also be able to further extend the conversation about what we are about to talk. So it's always a pleasure every time we talk, it's always a pleasure. I always learn something. You always got something in the plan, and thank you for doing this particular event. But before we get started to talk about the center, let's talk a little bit about you. We were just talking, you just went through COVID. So how are you feeling?
Oh, yeah. Well, first, Jorge, thank you for having me, and thank you, Ambassador Shapiro, and the whole team at the World Affairs Council here for having me today. I'm really excited to talk about the center and everything that we're doing within the organization. I think a lot of people don't know about it because we haven't really communicated all that well about it. As we're working to put a bow on everything we've been working on. But I'm excited to talk about it today. I'm doing great. My family has navigated the last year and a half quite well. Thankfully, my 4.5-year-old is at a very small school that's been very strict about COVID, so I haven't had to deal with some of the challenges some families have had with kids. But it's an adventure every day. And yes, I did just recover from a breakthrough case of COVID. I am fully vaccinated, as is my entire team, thankfully. This Delta variant broke through, and I called everybody I possibly could have met with, and I have no idea where I got it. So someone must have, breathed out heavily or something as I walked by them on the road. But I have a little bit of a COVID cough left, so I apologize for that. But I am thankfully through it. I did get antibodies at Piedmont Hospital here in Atlanta, which I do believe truly did help me. And actually, my husband got it as well. And he outside of taking a 3-hour nap one day, was fine and got through it just well. So we're very lucky in that, because we both know people that have lost family members and friends through COVID, and actually through our organization, I'm aware of at least 40 people that have died from COVID, at least in the first year. So it's been a rough year and a half, like it has been for everyone, but we're weathering the storm. We're grateful for everything we do have, including our health.
Yeah, it's great. This thing has touched at a personal level, and the circle keep closer, because I have similar experience than yours. But we were talking about having in-person meetings and Zoom meetings. This is a case where having a Zoom meeting is great, because otherwise we probably would have had to cancel with your COVID and the unknown. So that's one of the benefits of doing this. But to get to know you, so the group could get to know you a little bit. Are you from Atlanta?
Yeah, I'm born and raised. I actually live in my childhood home. I bought it from my mom about 2 years ago, actually. My husband and I did. So we live near Toco Hills, so North Druid Hills area. I was born and raised, grew up near Lakeside, went to St. Pius, though, for school, and grew up as going to CDC before there was a lot of security there, because my dad was there for 38 years before he passed away about 8 years ago. So definitely an Atlanta native, and I had no idea that I'd be landing back here after graduate school, but Hurricane Katrina did me the courtesy
and
of
just one of
pushing me back and
you
keeping me in
don't meet that
Atlanta.
many in Atlanta. Exactly. Now, I know you have a Hispanic background. Where's your heritage from? It's Puerto Rico, correct? If I'm not mistaken.
Sure, yes. My mom is from the island. She's from Puerto Rico. She's from Santurce, so in San Juan. My late father was from Missouri, and definitely I often say I'm culturally ambiguous, but it's great because I'm very blessed. I got married in Puerto Rico. I'm very familiar with the culture and the wonderful food. So I have the best of both worlds with the diverse background my parents have. Did I lose you, Jorge? Charles, did we lose Jorge?
Jorge's frozen, it looks like. So why don't you and I keep talking?
Jorge is frozen.
Until Jorge comes in.
Sure.
That you have.
Here he is.
Oh, there he is. Yeah, Jorge, you froze up for a second. What was your question?
How did you get? How did you choose health science path? How did you get there?
And I'm sorry, I didn't hear the first part of your question, Jorge. How did we get where?
Yeah, how did you get interested in the in the life science path, if you will? You started to talk about some CDC, I think you mentioned, but could you tell us a little bit of how your interest led you to where you are right now?
Sure, I can do that. I think I heard all of your question. I think it was, how did I get on this path? You're breaking up a bit, Jorge.
Right.
Yes. So I fell into this path. After my undergrad, which I went to a women's school, Sioux Broward College in Virginia, I came back here and was an ORISE fellow in chemical demilitarization with ATSDR, which is the easiest way to describe it is like a sister organization of the CDC, and the CDC helps manage it. It was a great research opportunity. I got my one and only publication there, and got really interested towards the end of my research, though, in health communications, and had the opportunity to work in a few communities in Oregon and Alabama, and see how communities learn about the health of their community, how they interact with government around that, and particularly with these bases that we were doing research around. I'm going to go on with answering this, Charles, since it's Jorge reconnects. That time got me really interested, like I said, in health education, as I saw, various sometimes communication breakdowns, and I got just really interested in understanding how people consume, sometimes challenging information and intimidating information around the sciences and health. And I decided to go get my master's in public health. And I ended up doing a dual degree at Tulane in New Orleans in health communications and education and maternal and child health. I did maternal and child health more due to a personal interest in it, and had a wonderful time living in New Orleans and working with communities there. Right as I was getting ready, in the process of moving back, the storm hit, Hurricane Katrina. I still can't believe it's been as long as it has been. And though I had planned to move to Colorado, the storm made sure I came back to Atlanta. And after 6 months here, I remember my father was like, "Okay, Maria, it's time to get a job." So I got a job, and it was with the organization Georgia Bio, which is the Life Sciences Trade Association supporting the broader life sciences community here in Georgia. And we work very closely with bio and pharma, and I still oversee that particular organization, that division of the center now. So I work very closely with Georgia's biotechnology, pharmaceutical, medical device, diagnostic, et cetera, companies, and the service organizations that support them. And I really found it valuable as I saw my worlds colliding, I think about in 2016, when we helped start the Georgia Global Health Alliance. We saw our worlds colliding between global health and life sciences during conversations starting up the Georgia Global Health Alliance. And it was really exciting, because I always knew that global health and public health were very interconnected with the private sector and the innovations that come out of it. And I think all of us are even more acutely aware of it due to COVID now. So it's been an interesting pathway, but I grew up in a household that was filled with public health because of who my father was, and I was blessed to know many of the legacies at CDC, such as Jeff Copeland, a former director, and Dr. Satcher, who I think some of us are familiar with from Morehouse School of Medicine, David Satcher, and many others. So those are people that were household names for me. And I'm very grateful now to see my worlds in the biotech world and the public health world connecting as we stand up this Center for Global Health Innovation. See if Jorge is back with us.
Yeah, I'm here. I hope you can hear me,
Okay,
but I think you answered.
I can hear you just fine.
Okay, and thank you, Charles, for carrying over on that. But you answered the question exactly. And then I was going to ask you, but I think you already did. That the trajectory, if you will, from Georgia Bio to the Center of Innovation, which you just talked about.
Sure.
So could you talk a little bit about that?
Yeah, no, I'd be happy to. So about 3.5 years ago, actually it was 4 years ago, the ideation started. I had a meeting with, I'll never forget this, with Marianne Peters at the Carter Center, who's the past president. And she was telling me about some work they were doing and showed me a medical device product that they were looking at they needed for, I think it was the river blindness program. And I was fascinated because medical devices was my world. That's what I've been doing for 12 years at a time. And this was a global health organization that worked in neglected chronic diseases mostly. And it was just such a distinct, example of how my world work together, that private world plus this NGO side of the world that actually implements programs and works within communities. And I remember I called David Hartnett at the Metro Atlanta Chamber. You know this better than I do, Jorge, but the Metro Atlanta Chamber is one of the largest chambers in the country, and it's very influential. And we have some very powerful business partners there. And David and I were talking, and he's like, let's see if our board will make global health a priority as one of our strategic pillars for the next few years. And threw together a quick paragraph overnight and tossed it over to David. And a couple months later, I got a call saying, yes, let's do it. Ed Bastian was a deciding vote on this over at Delta, and we're going to focus on that. And thus burst the Global Health ATL initiative, which has evolved over the last few years into what is now the Center for Global Health Innovation. That particular initiative that the Chamber and Deloitte, as well as we at the Georgia Global Health Alliance and Georgia Bio, help coordinate our over 250 volunteers and organizations to help ideate what this center could be. We had 3 core projects. One was a physical innovation district. Another was a disease elimination team, which has evolved into a educational, global educational program being led by the renowned global health legacy, Dr. Bill Faggy, excuse me. So I'm for those that work in public health, I'm blessed to have a weekly 90-minute call with Dr. Faggy and the project lead on this educational video on the, it's going to be a series of 9 lessons on what we've learned from smallpox and the only human disease ever eradicated, as well as pull in stories from all around the world so we can educate young people on that story, that historical story, the importance of leaving legacies behind that teach future generations about the importance of collaboration in order to improve wellness and health. And we'll have more information coming out in the new year about that, but we're working very closely with large funders on that project, including Ford Foundation, Conrad Hilton Foundation, Rockefeller, Gates Ventures, and many others. Locally, the Task Force for Global Health, the Carter Center, and CDC, of course, have been great partners on this project, but this is going to be rolled out globally out of Atlanta as an educational tool to be used in communities all around the world, and particularly with students. So we're excited about rolling that out in the coming year. So that was the second project outside the district. And the third was our disaster team, which has evolved into our GHC3, our Global Health Crisis Coordination Center. It's been a lot of coordination, a lot of lessons in governance, organizational mergers. We merged Georgia Bio and the Georgia Global Health Alliance to officially form the center 1.5 years ago. And that brought together 2 boards and a number of advisory groups in order to pull that together. And we've had some great support from locally King & Spalding and Holland & Knight, the law firms, to help us get through those legal hoops. But it's been drinking from the fire hose since that merger, because the merger happened in February of 2020, and a month later, COVID really started hitting, and we stood up our GHG3 division. So it's the evolution has been fast, but it's been community driven with great support, like I said, from a number of service provider partners, but also our universities like Emory and Georgia Tech and UGA and many others. So we're excited about how this is moving forward in a very collaborative public-private partnership kind of way.
This is fascinating. I remember those days when I was still at the chamber, and David said, "Okay, we're going to plant the flag, and Atlanta will be the capital for global health," and then the evolution of the global health ITL, and then just before the COVID, when we met over at your office, you were talking about the next step into that, which is coming into fruition. But you packed a lot in that year, so there's a tremendous amount of progress that you have done in the last year or so. But let me bring it back to something from that you and I have talked about this several times, and it goes back to the mission of the center itself, and your new strategy as you talk about improving health outcomes and reducing disparities. What does that mean? Mm-hmm. What's behind that vision of the center between reducing disparities and health outcomes?
So the center really envisions and believes that a world in which collaboration and innovation will lead to global health equity, and that means tackling disparities. So, but it truly requires collaboration. Like I said in that meeting with Marianne Peters a few years ago, we were so siloed. Our public health partners, our global health partners, our life sciences sector, and our digital health, our very robust digital health side of things. And these sectors, they work independently, they overlap sometimes, but really the data that's collected, the partnerships and the innovation that comes out of the private sector need to pull in the public health side of things, those organizations that are actually doing community-driven work and planning in order to have comprehensive plans that are really going to affect change. Having that initial collaboration, open lines of community are just really going to allow for better partnerships and more effective programs. And tackling health disparities, it's a big project. There's so many ways. It's a big goal. There's so many ways we could all tackle this, and we all do it in our own way. I might say all of our public health partners. And how we're really manifesting it is being a vehicle and a connector and a neutral convener for these parties, as well as an enabler in some respects. So we view our role as, like I said, being that neutral convener. So one place that we've been able to do this, and we've got a number of examples, is we have a faith-based roundtable for faith-based leaders in response to COVID. So we have over 150 faith-based leaders that come from around the country to tackle vaccine inequities and how they communicate that with their respective congregations, or whatever the right word may be. And this group of people meets about quarterly, and they hear from each other. And these are people that in organizations and faiths that don't typically interact. They're, I think on our last one, we had a person from the Muslim faith present, and then someone from the Jewish faith present, and then previously a Christian side of things. And we provided and developed toolkits for how to communicate with their various, audiences. And they're able to share, experiences and hear from each other. And a lot of these inequities around vaccine hesitation and just questions around it, people are going to go to their trusted resources. And those are often, faith-based leaders in their respective religion, whatever that might be. And we're able to provide them with the tools. And there's nothing in it for us. We just like to be that enabler and that connector and facilitate those conversations. Sometimes when, there might be a narrative breakdown or, whatever it might be. And we found that by providing these toolkits we've developed and sharing other resources that others have developed, like CDC Foundation and others, it's just valuable by just having this forum so they can hear from their colleagues on how they're dealing with the similar challenges in that. And that's that's one inequity. These vaccine inequities is a huge deal. So working with community leaders like these faith-based leaders is really important. And that's just one example. I don't know if it exactly answers your question because it's a big question, but.
No, yeah, but absolutely. I mean, we can spend hours just talking to each one of those things. Because at the end of the day, I mean, you said this: health is a global issue, right? So whatever happens in one part of the world, we're all at risk. So, and you did mention all your partnerships, and no organization can do this on its own. But this reach out has been fantastic. Like in the shape that you have been discussing. When let me ask you, when since this audience tends to gravitate a lot to the global issues, how do you ensure that you touch the right touch point at a global scale in order to achieve what you're just talking about? How do you do that global reach? And by the way, it's the reason I want to ask this because the audience here is very well connected at a global level. And
Sure.
we could be partnered for you and helping you make those connections at a global scale.
Yeah, and I think the World Affairs Council in general is an outstanding partner that I need to work on growing the relationship with. So I would say it's an effort. The how is an effort we're working to scale. A year and a half ago, we were just so you can understand the scale change, we were $1 million organization at the beginning of 2020. Within 10, 12 months, we were $4 million organization, and now we might be double that by the end of this year. So we've had dramatic change, and I will say it's required a lot of internal growth and creativity and just passion. And my team's been amazing in putting in an unreal amount of an unreal amount of time in order to make sure we're successful. Our global reach is just now really starting to scale. As everyone knows, the global really became local right when COVID hit, and we saw the impact it had on the state side. And our global health partners like MedShare, for example, they suddenly were having to respond to the US. And we had to work with Charles and their team over there to help them understand how to work with the U.S. and allow them to be able to bring in resources into communities here. It was kind of like a flip-flop for many of our partners in global health. So enabling that and connecting people was really important. Now that we're moving into what I'm calling a bit of GHG3 in the Center 2.0 is we have built a lot of relationships and great connections nationally and internationally, especially with our COVID unit at GHG3. And we're trying to understand where we strategically want to go and where we want to focus. We have a project called COVID, which is funded through the Task Force for Global Health, but it's a CDC grant that really tackles vaccine inequity and communication. That has been focused on the US, but we are hoping to take that global as vaccine hesitation continues to be a problem well beyond the US borders. And additionally, we have interest in diving into things like climate change and antimicrobial resistance challenges that we know are just in the next coming decades going to be devastating the world if we don't start tackling AMR, so antimicrobial resistance. So those are some strategic areas that we're starting to work with partners in the UK and Canada, and we have a number of team members that are already working with Africa on our global work. We have a project specifically with the Carter Center that we're moving into phase 1 right now that will be taking place in Liberia to help improve their systems and their communication with partners on the ground in Liberia around their mental health programs. And the system we're building for that with some Atlanta private sector partners is really going to be able to be scaled internationally and apply well beyond just mental health issues. So this partner portal, as we're calling it right now, so local NGOs and partners on the ground can interact and share information more effectively is what we're working on with the Carter Center. And like I said, that's early stage right now, so I can't really speak to the details on it just yet, but we're really excited about that relationship and that project scaling not only in Liberia, but hopefully across other countries the Carter Center works in, and eventually even bringing it back domestically, because there are a number of communities here that have some really, really poor health statistics.
Well, this will be a great segue to address the audience. Please, if you have any questions, just go to the bottom of the screen and press there where it says reaction, and you will see like at the bottom of that, raise your hand, and hopefully we'll see you, or Charles, you can help me in case I miss somebody. But if you have any questions for Maria, Charles, you have one. Is that you? Yes.
That's me, and I do.
Yes.
So
see,
Maria,
I saw you.
That's it. It's working. Maria, this all sounds so fascinating with all this around Atlanta. I moved here from San Diego, where there was a huge biotech industry that the university, was centered in the university world and then goes to the commercial side. And I suspect that's what the Metro Chamber was hoping to encourage here in Atlanta, is a biotech industry here in Atlanta. How is that side of it working? Is there a private sector side to what CDC and Emory and Morehouse are doing?
Well, sure, and hopefully I'll try and answer this as best I can. Yes, there's always a private sector side, and that's really what we're trying to do, is connect that private sector world, that biopharma, life sciences space, more effectively with our public health partners. Like I mentioned, there's a big piece of it. Like I said, some of our biggest partners are within the agency and are the agency itself, of course, and our universities. So when we think about our third and biggest project out of Global Health ATL, the center is also a physical space. And creating, and this is public already, that we've been working on a 200,000 square foot innovation center, which would be the first of its kind innovation center that intentionally pulls in global health partners, but at its core, it's a life sciences space. So we're actively recruiting pre-leases into this space in Midtown, and we're very excited about it. I mean, we're talking a physical space to grow our life sciences sector, which is crucial for the big biotech companies that may not even have a presence here, and for small companies that are spinning out of universities. So the space has been ideated to have wet lab space, significant wet lab space with graduate wet lab space. This is something that is a gap in the Georgia market, not just Atlanta. And it'll be a home, and I view this regionally as a way to connect across our region. So it'll also have meeting and event space, which is a huge, huge need as well within our Atlanta community, but particularly in our innovation space. We've been meeting as what we fondly call just, ballrooms, but they're not designed for really international connectivity. We want to be able to provide in-person and hybrid events and with a really good state-of-the-art systems involved. I envision down the road making sure we even have translation within in-house and all that, so people can internationally connect and plug in. One thing I didn't mention is Atlanta's, so one of Georgia's fastest growing industries is the life sciences sector, and the life sciences sector actually is the highest paying industry. So we have a workforce arm to the center as well, which used to be the Georgia Bioed Institute, but we're in the process of pulling it into the center. Our institute does teacher trainings and introduces life sciences and public health careers across Georgia. And in the last 2 years, we've reached over 24,000 students and introduced 21st century careers. We've brought in people like Mark McKinley from the Task Force for Global Health. He talked about his vaccine trajectory from the private sector world until he moved over to the Task Force for Global Health. And he's a great speaker. I think we have that recorded somewhere online. And we just try and inspire the teachers and educate them, and they bring it into their classrooms. And then we actually also provide, we're the only depot on the East Coast that does this, we collect surplus materials from our private sector partners and put it into science classrooms for free. So we have a warehouse up in Tucker, Georgia, north of Atlanta, and we distribute that. We have monthly depot days for teachers to come shop for science stuff, and we're hopeful that even could potentially scale internationally. We have done this. It's more than a pilot now. It's an effective program, and not only scale it across the Southeast, but also scale it internationally with some partners. We've discussed this with some of our nonprofit partners. Our model about training teachers and giving them the tools to teach is something we could effectively take globally with partners like we already have in MedShare and MAP International and others. So we're excited about the growth of our workforce arm, and growing the workforce here is really important. And I know I went way off your question there, Charles, but yes, when we look at our district, one thing to note is we are hopeful that we will have an academic corridor there where our universities could come and connect. And I would say our local universities, but even some of our partners. We've got projects with Johns Hopkins and I think Stanford and a few others. If they're in town, we want to be able to put them up give them a place to sit and work for the day or the week, whatever it is, and let them be able to connect with our innovation ecosystem, whether it's life sciences private companies or NGO partners with CDC Foundation or even some of the smaller organizations. So, and it's really important that our academics connect with our private sector partners, because the private pharma and biotech and even medical device world, they rely on a pipeline from our university systems. So they're not successful unless our universities are successful. And we will be able to enable our, at least on a local basis, our Georgia universities to really just connect more effectively in the, with the private sector space. We truly believe that. And I've actually hired somebody, her name is Edie Stringfellow, who actively is traveling to Boston and traveling to California to help bridge the Southeast with those particular hubs. We have great relationships also in the global health space. I work with the Bay Area Global Health Alliance and the Washington Global Health Alliance in Seattle on policy events. That's another thing we're really wanting to do, is more advocacy and being a educator of the importance and value of public health to try and break through some of the noise and misinformation out there. So I really view 2022 as a massive growth year where we'll be coming out in a big way with being an even stronger ally to our public health and global health partners, but as well as our life science partners.
Yeah, you are truly an ecosystem where you connect the dots between the private sector, the academic sector, the government side, both domestic, local, global, which is fascinating. Let me ask you, in terms of what you launched the center, you mentioned before, just before COVID. From a strategy perspective, how did COVID impact the vision that you had prior to the pandemic to where you are right now? Any salient points from that perspective?
COVID, and from a high level, COVID just affirmed what we were trying to do. Right. We've heard a million times, there was unprecedented collaboration to respond to COVID with our public health partners, as well as within the private sector and the supply chain partners. And that is something that we continue to see. And I would say we, life sciences and public health, truly hope that, and we'll be trying very hard to continue that collaborative effort. We have changed the business model, the industry has changed the business model with things like Project Warp Speed and getting those vaccines done and many other projects, that we can bring more treatments and cures to patients. We can create more effective programs that are going to help communities across the world. Now, I think from a center level perspective, strategically, it was a little bit of a mess. I'll be quite candid. It was hard at first. We went through the legal merger in February, and we had planned to focus on launching the center, but we immediately had to pivot to standing up our crisis unit, our GHC3. The GHC3, by the way, the concept was led by Judy Monroe at CDC Foundation and Charles Redding at MedShare, and we put a ton of focus into that. It was seeded by the foundation and Microsoft, and we immediately had to staff that particular division up to help with coordinating everything on the early days around PPE, to then talking to some of our partners about how are we going to integrate data and share data. There was a lot of things happening at once. So strategically, it was a lot of reacting and trying to connect people and enable partners to more effectively work together. We had one project where we had I think it was IBM and Dell and Microsoft all on the same call, and there's these competitors, and they were happy to have a conversation and find a way to find a resolution together. I think, now we're finally breathing a bit. The pandemic is most certainly not over. I don't want to be disrespectful in any way, but we're able to be a little less reactive and step back and be more strategic. So right now, where we're the center, my focus and my priorities moving into the new year are the physical space. That is important. I will note that we are building this to CDC ventilation standards. So this will be the first post-COVID conference center that will allow for safe meeting. Secondly, with the right precautions in line, GHC3, our COVID unit, we're really looking to prioritize that to be a place where we can pilot programs, we can connect typically competitive partners in a way to, really create meaningful programs and ways to to partner and develop, you know, technologies that otherwise may not be able to be done for our nonprofit partners. And then one other piece of it, separate from piloting programs. Oh my goodness, I apologize, I just forgot. But well, there's a number of different projects. So strategically, we're really stepping back, seeing what GHC3 and the center's crisis unit's going to look like moving into 2022. We want to also create that partner portal that I mentioned with the Carter Center, that we view that as an asset the center is going to be able to have to help support our NGOs when they're responding to other disasters as well in the long run. So that could be natural disasters, to help coordinate and connect partners. So let's say somebody has water they want to donate, we can connect them with a group of nonprofits that may need it as they're responding to something. I did this last week with y'all sponsor UPS, actually. I made a connection for them for some PPE that needed to get moved from a private sector partner. So we want to find a way to create a system and an effective way so those types of relationships can happen and grow, and we can also move supply to get into communities faster and more effectively. So again, you know, it doesn't entirely answer your question, but we're going through into this next phase of strategy. We're being less reactive and more proactive and strategic as to how we continue to respond to COVID, but also start to move into those other new disease areas and spaces.
Yeah, I think having a physical space is a game changer, because now you're giving a physical face to the organization where you can convene people and do everything that you're talking about. Again, if anybody has any question, please use the reaction button in there and raise your hands and we will answer. But Charles asked you a question before when he was in San Diego, and everybody thinks about health science in San Diego, biopharma, or Boston or whatever. So why, as an economic developer that we are at Pendleton, I need to ask you, why Atlanta from the health side? Other than, I mean, you talked a lot about the center, but how about the greater region? Why Atlanta for health?
Sure. And I will say this, you know, we're working to be more of a global center, and that's going to take time. And
absolutely.
But I would say why Atlanta, but also why Georgia. We have we have outstanding research universities. We Emory in particular, and Georgia Tech, and the IP and the technology coming out of there is something that I think is an untapped value that the private sector is really getting more and more interested in. We've had an unusual spotlight on Atlanta because CDC has been here for the last year and a half, and it's something we should continue to take advantage of. There's some practical data points that I will say. From a global health perspective, we did a study about a year and a half ago. Atlanta has the largest global health and public health workforce, and we also run more disease elimination programs out of out of Georgia than anywhere else in the world. Obviously, you know, I want to be very fair to our friends in Seattle and Geneva. They have huge public health workforces and partners as well. But we do, and I think many in public health do believe that Atlanta is the center of global health. But you know, global health at its core and public health at its core is collaborative. So it's very important that we continue to grow and maintain those relationships with the other big areas in public health. But it's an economic development driver that has never really been focused on, and the physical space is simply a catalyst to do that more effectively. From a life sciences standpoint, I would say, again, so we run the only training institute in the Southeast. RTP is a big hub, but RTP is also very full right now. And frankly, we've worked to get the state of Georgia to begin to entertain more incentives for the life sciences sector. And actually, Governor Kemp signed into law last, I think it was April, the first life sciences focus and tax incentive for the industry, and particularly in the manufacturing space. So, and Georgia has been shortlisted as a manufacturing supply chain logistics hub for life sciences. And that's an area that we're seeing more and more interest in. And I think I can candidly say we have had, since COVID hit, more interest from life science companies in Georgia in the last year than we've seen in probably 10 years combined. It's been a massive uptick. I think that has a lot to do with COVID, has a lot to do with the spotlight we've had on it, has a lot to do with the typical economic pieces of it. Our airport is huge. We can get to Europe, we can get to Boston, we can get to California. It's a natural southeastern location, with all due respect to my RTP friends. And it's something that if the state is willing to continue to support its growth And we as a center continue to work as a training and workforce hub in particular. We're going to have a national spotlight on this. The last thing in the workforce is the Southeast in general has diversity unlike anywhere else in the country, in the US. And we have had very large biotech and pharma companies reach out to us about building that talent pool for them. That is something we are actively working to cater to, and we want to provide, starting at the youngest of ages, inspiring, our communities that we know are very diverse to look at careers in public health and life sciences. And I think as we continue to build that and win more grants, hopefully from NSF and NIH around that, we will be able to become a different type of hub, but a hub of its own kind with a specialty in public health and global health for life science companies. And we will quickly be on the flyby, if you will, for those business development partners in that sector. So we're just trying to enable that because no one's really done that in our region.
Yeah, you should work for the chamber. You done my job easier.
I don't know. You think I'd hung out with them for like a decade and a half or something,
exactly.
Right? But it's true. We can. And I want to do it from I've been with Georgia Bio for 15 years, and it breaks my heart every time I meet a young entrepreneur or a researcher at a university that's like, I just need like a bench, a wet lab, and I have this amazing technology, or we have one company that's working on a vaccine for a neglected tropical disease, and they're having to set up in Argentina, which is great for our partners down there, or they're moving to South Carolina because we don't have a bench. We are building that infrastructure to keep that technology and those entrepreneurs in our community, and then we're building the workforce for them to actually grow. So this is something we as a center need to do, and we have a unique capacity in public health. And as we've all seen with COVID, public health and global health and the private sector innovation, whether it's in the digital health side or in the true pharma side, we have to work together if we're going to really help communities be well and be healthy and empower them to keep themselves economically, healthy and to grow and everything. So we're excited about the potential for us to help support the growth and support and enable our partners to achieve their missions. So as that neutral convener here.
Great. Well, before I turn it over to Charles, it's amazing. It's 12:45. I mean, time just goes. I got tons of other questions that I would love to ask you because we will talk forever. But Maria, thank you very much for sharing your vision and your leadership with all of us, and to thank you for everything you do for health, for Atlanta, for Georgia, for the world, for that matter. And also thank you, the audience, for listening and for continued support to the World Affairs Council. And Charles, let me turn it over to you for closure.
Thank you so much, Jorge.
Thank you, Jorge.
This is 41 minutes flew by. This has really been terrific. And I want to, Monica Swan, who's the Dean of Public Health at the Wellstar College of Health and Human Services at KSU, sent a message. She had to leave, just saying how terrific she found this and how interesting. And I mean, it really is something that Atlantans need to be aware of. And just like there's a whole system of ancillary industry that the movie industry and hip hop industry in Atlanta and fintech have spun off. The same is true for health sciences and biotech, so that you get builders who know how to build to meet those CDC standards. So it's not the first time they're doing it. You get real estate agents who can help the companies find the place where they can carry out research. Lawyers who work in this particular field of IP, right? I mean, so there's a whole bunch of stuff that comes with it. It's not, I don't want to say just scientists. It's not just scientists. It's scientists plus, researchers plus, and that's to the benefit of all of us. And when you're looking, as Maria said, super well-paying job. So that's just tremendous.
Yeah. Exactly. And I did see her question. Just so you know, we are having active conversations with Wellstar on a few different projects right now. So we're very excited to continue this conversation with Wellstar, and I hope I can connect with her. I don't have her information, so if y'all want to share that, that'd be great. I did put our website in there. Yeah, I did put our website in there. We will be having some press releases coming out in the coming month and a half. So it's a great place to stay plugged in. And I hope I can work with you, Charles, and your team to push some news out Also, I'm going to do a plug for our podcast, GHC3 Talks. We've got some really great conversations that happen there by Spike and Serge, our hosts. And we bring in some excellent international partners. When we were going through the crisis in India last spring, we brought in a pharma company that was based in India that was working on the response there. I think we just had a conversation with some partners down in Louisiana on the hospital system crisis there. So, and it's all over the place. We've had, I forget which name, but someone from the UK, very impressive on antimicrobial resistance. So our podcast is very much international in and of itself, and I'd encourage you to check out GHC3 Talks, and I'll drop that into the chat too.
Oh, that's good. So if you can get
Excellent.
everybody can follow it. Maria, thank you so much. This has just been a tremendous program. Jorge, I want to thank you. Speaking of plugs, I've got to do a little bit of self-promotion here. Plug the World Affairs Council. So on Wednesday, 2 days from today at noon, we have a program, a flash briefing on Lebanon, civil unrest and economic collapse with Rare Balian and Shana Robb from the Carter Center. This is going to be tremendous. So it's this Wednesday at noon. It's free. Please register. Then on Thursday, November 4th, we're going to have an in-person program at the Commerce Club with Nelson Forster, who's the ambassador of Brazil to the United States. It's going to be 6 p.m. It'll be reception and food, and then a very informal conversation between me and the ambassador of Brazil. The title is 5 Things You Need to Know About Brazil. So please join us on November 4th at 6 p.m. And then Saturday, November 6th in the morning, our young leaders have organized the 2021 Young Leader Conference, and the topic is transportation infrastructure and resiliency to climate change. So it's going to be great, organized by the young leaders, but us old leaders are invited to attend. It's going to be live and in person at a place whose name I can't remember right now, the meeting place, something like that. Anyhow, it's very cool. Y'all join us. I want to thank Hina Rennie, who is our program director, Laura Brower, and Anna Petrova, who are our graduate assistants working on this, and our interns, Riti Sarangi and Amiel Forbes. And above all, Maria Thacker Goethe, I want to thank you, and Jorge Fernandez, thanks. You've done a great job moderating. Thank you all. And everybody has a great afternoon. Thanks. Bye, y'all.